On to our guest speakers. We're very, very happy that they've taken the time out of their very, very busy lives. Both are very accomplished women. They are both long-term residents of the Valley. Carolyn Henry is the manager for community care for the entire Valley. She's a graduate of the University of Montreal. And Tara Gilchrist is a graduate of the University of Alberta in the management of recreation and specialized in recreation therapy. She has been the manager for 6 teams here in the Valley for 13 years. We're very excited that they're giving us the time.
Hi, good morning, everyone, or good afternoon.
There you are. And Tara.
Good afternoon. I'm so glad to be here.
Great.
Is it working?
Looks great. That looks great, Tara.
Perfect. Well, I'm glad to see that. All right. So FCSS is a provincial municipal partnership that's been in place in Alberta for over 50 years. It's the only province in Canada that has a program where the province supports preventive social supports in partnership with municipalities. So 80% of the funding comes from the provincial government, and 20% of the funding is then matched by the municipal government. One of the beautiful things about it is it gives us local autonomy to within that world of preventive social programs to look at our community needs and base our programming and supports off of locally what the needs are. We're guided by an FCSS Act and regulation that's developed by the province of Alberta. And there's a few things that are prohibited in there that FCSS is just simply not allowed to do. And those are, we can't provide basic needs. We can't provide anything that's recreation in nature. We can't provide anything that's primarily rehabilitative in nature, or anything that's normally the mandate of another provincial government department. Outside of that and on that prevention spectrum, we have a lot of leeway. You'll find in Canmore, we also have a few additional programs that don't fit into that act and regulation that are offered by FCSS, but they're funded 100% by the town of Canmore because they were a community need that was identified, and we were the right department in the town to deliver the service, but we couldn't do it within the mandate of FCSS funding. So on that generic role, one of our key roles in community is information and referral. So most agencies, if they don't have the answers, they refer people to FCSS. We will investigate if we don't know, and we try to keep very up to date on the various services that exist within the Valley and in Calgary for things that we don't have here, so that people have a relatively smooth transition to accessing the services that they need. We also do quite a bit of community development where we're looking to support nonprofits and other organizations. We're in the process right now of developing a website. If somebody comes to us with an idea, we try to bring community at the grassroots level together so that it is making our whole community stronger rather than taking on filling all the gaps ourselves. So we do a lot of what we would call working from behind and supporting groups to formalize and to meet many of our community needs. We also focus on some training and workshops, things like Rent Ready, Healthy Little Chefs, things like that. We have ongoing programs that we provide affordable services with the high cost of living. It gives people access to a number of services at reduced rate in community so that they can fully participate. Volunteer income tax, again, is a program where with people with simple returns, we're able to provide income tax support. And that ends up bringing anywhere from usually about $700,000 to $1 million back into community through people completing their taxes and then receiving the benefits or the refunds that they are eligible for. And we also offer solution-focused counseling. So when I think about some of the services that we specifically offer that might be a nice complement to primary care network, some of the ongoing programs we offer are volunteer driver in a normal time, which is currently operating as specialized transportation because of COVID. So for about 10 years, we've been doing about 170 rides a year into Calgary for specialists with volunteer drivers. Right now, our volunteers are often in the risk zone of 65 plus for COVID. So we have secured some grants, and we're using taxi passes or taxi companies that have larger vehicles and are able to socially distance and not put our volunteers at risk. But we certainly will go back to volunteer driver once the pandemic is over. We also have Meals on Wheels. It offers $6 a meal at lunchtime, warm to anyone who needs that. We have a Helping Hands program that has a number of volunteers with multitude of skills. And essentially it's to support seniors or people with disabilities or people who can't do some of the work themselves. And it's just literally some of the random asks. It might be as simple as a senior saying, I can't change the light bulb in my hall. I'm scared to go up a ladder at this stage of my life, and having somebody do that. It might be somebody going shopping on their behalf. The volunteers are all screened and vetted, and then they respond to a multitude of different asks. We also maintain a resource list in FCSS that includes people who are offering personal care, housekeeping, minor yard maintenance, things like that, so that folks can vet that list themselves. But it's an all-in-one place that sort of helps seniors primarily with accessing services all in one place and knowing what they have available to them. We also support folks with completion of forms. So whether that's AISH applications or applying for old age security or Alberta Seniors Benefits, just various things like that. If the forms are daunting, we're able to support people in getting those done completely and fully so that it doesn't get returned or they don't get rejected. We also have a Taxi Pass program. It's one of those that falls outside of the FCSS Act. It's got low income criteria attached to it, but essentially it's designed to, within the town of Canmore, allow low income seniors or people with disabilities to get out of their house at least once a week to attend to something. So it's 8 taxi passes, essentially one-way rides, so they can get out of the house at least once a week. We have some seasonal programs. Cycling Without Age is designed for seniors or people with disabilities. And it's the trishaws you may have seen around town with the red hood that we are able to take folks out on rides to be part of the community, to feel the wind in their hair. And the cycling is done by a volunteer pilot who's trained on how to use the bikes. We do have a really great example of a person in Palliative who we were able to have out on the trishaw about 5 times in the last week and a half of their life with their family riding along. It was a very beautiful opportunity, and I think more opportunity exists as we move forward of how we could perhaps partner with the Palliative Care Society. We have Snow Angels. Oh, I see it's on there twice. It has low income criteria attached to it as well, but it's essentially folks who may be unable to manage their snow in the winter and can't afford to pay the neighbor kid or a company to do so, that we're able to get their snow removed so that they can have safe access in and out of their home. Volunteer income tax, again, has a low income criteria, but we complete taxes free of charge for folks. We also offer some workshops, and these generally occur once a year, sometimes more frequently depending upon demand. And during COVID, that as we've had to adapt and a lot of other work has sort of been on our plate, this schedule has been decreased. We didn't offer any of these in 2020, but we plan to see them return, whether online or in person, in 2021. So we've always offered how to write a will, personal directives, power of attorney, and being the executor to a will. As well, we have Russ from the funeral home come in and do sessions on what to do when someone dies. We often offer grief workshops or a series of workshops, also a series of workshops for care for the caregiver. So I talked really fast because I do, and I wanted to give you a high level and then allow you to ask questions that were more specific when the time comes. So I'm going to stop my share and I'll let Caroline take over, and then I look forward to your questions.
Perfect. So first, I want to talk about a little bit our mission in home care. So our mission is to provide a patient-focused quality health system that is accessible and suitable for all Albertan. And here in home care, we're like working with the client, the family, the external contracted service provider, and community-based resources like FCSS and the Bow Valley Palliative Group Society. And also we're here to focus to create an environment for the client for them to be able to live at home or in the community setting as long as possible. So today I'm going to talk a little bit about like rural palliative home care that we have here in the Bow Valley. So many of our like community members want to stay at home as long as possible, and home care offer like professional and personal healthcare services to the patient and the family who are living with a life-limited illness or at their end of life. So what we are like providing as services is like we are able to coordinate in home care and support the patient and their family by the case manager. So every client has a case manager that is assigned, and this case manager will do an assessment and make sure they are providing services in the home, and all our like home care or like palliative, like have a training in palliative care, and they work closely with the primary care physician. So also we have a multidisciplinary team, and that include occupational therapists, respiratory therapists, physiotherapists, and social worker. And also we are able to support all like personal care in the home and caregiver respite, equipment needs, and service are based on the individual client needs. So who can access home care? Client can access the service by self-referral by calling Community Care Access, and I kind of put the number down there if anybody wants to take note of that. Or if you're already a client in home care, you just speak with your case manager to access more services. So we don't have any fee associated with home care. The only fee that you can have, maybe it's like for equipment, supplies, or medication. And that will depend on like what the family requires, and some fee may apply. So clients that are palliative are usually eligible to Alberta aids to day living, so some equipment, and the palliative coverage program from like Blue Cross. So we do have access to rural palliative care consult services, and they are like experts supporting like our team, Canmore and Banff Home Care, and the acute care facility. So a palliative care doctor and nurse specialist with us, and the client and the family and the primary healthcare team to provide like an assessment and symptoms management, information about how the illness may progress, and the care suggestion to enhance like quality of life, and also like psychological like support. So also what we help and support client is like with the events like care planning and the goal of care designation. So advanced care planning is the process of talking about and documenting your wish for your healthcare. And the goal of care designation order ensure the healthcare provider to provide treatment that is medically appropriate and right for you, and you are the expert in your own healthcare value and wishes, and we want to make sure that we are supporting everyone in this process. So also we are able to have access as extra funding that call rural palliative care in home funding. So I'm going to talk a little bit more about that. So this is an extra funding that we can get. And the reason why we can get this funding is because home care service in rural area are sometimes limited. And rural PCN palliative care and home funding was discontinued in 2017. So a new strategy needed to support our area and the palliative client who wish to remain to their home when desired. Oops. Okay, so the additional in-home direct client care service can allow client to have personal care, respite, nursing care, HCA, healthcare worker, LPN, RN, or other. It can be a friend or family that you contracted, and that will be provided care for you in your home. And it can also be caregiver services, and it can be homemaking, and sometimes even massage therapy. So when are we able to give the client access to that extra fund? It's when the unmet care needs are not done by home care, because we have our limitation. We are working day, we're not working at evening, we're working not during the night. So if you need extra help and the existing resources are exhausted, we are able to provide you with that extra care. So if you also desire to stay at home and you need more care, and also if you're end of life in your illness, you're able to access that program. And that program was launched on October 1st, 2017. So we've been using this program in the Valley for the past almost 3.5 years. And that's it. That's all I have. I'm sure you have a lot of questions as well.
So I'll open it up to questions now. If you can put your, down on the bottom, there says reactions. You can put your hand up using reactions.
Yep.
Or you can just say quickly out loud, I have a question.
And there's some in the chat as well, Kathy. There's a question in the chat from Michelle. Is there a limit to the add-on home care services? So let's start with that question.
So is it in regard of palliative care or in general?
Yes, palliative care.
I'm not sure I understand. Add-on home care services. So basically, we are doing assessment and we're providing care, but we do have some limitation in our capacity with the number sometimes of referral, or also what I mentioned is if care need to be done after hours and we don't work on those hours. So that palliative and home funding is the perfect solution. The client are giving the opportunity to hire privately and have a certain amount of money to be able to hire. It can be a professional staff, or it can be also a neighbor, a friend, or a family member to be able to provide care in the home.
So Carolyn, it's Michelle here. Hi.
Hi.
So yes, I guess I'm actually not that familiar with that added on, so the off hours. bit. Two things, actually. I'm thinking of my mother who lives in Northern Alberta. Is that a province-wide program, or is that specific to the Bow Valley?
It's specific to the Calgary zone, right?
Ah,
And I know that our program have been like really it's been working really well. So I know they're like sharing with the other zone with Alberta Health Services, and they're looking at like maybe having the same, but I will have to have a little bit more information and like kind of ask the question like directly to the director of the palliative program for the Calgary zone. But I know that people have been extremely interested of this amazing program that we have.
Kidding. No kidding. I mean, that is amazing. So the question that I was asking is there, so once that somebody starts accessing that off hours help, for how long, or is there a maximum that they can use, or can they use that for 6 months or a year? Like, how long can they use that?
So palliative care, it's usually you have like a more or less diagnosis of like 6 months. But you know, we had like some occasion that like the care was extended for a longer period, and it's like really like a one-to-one based program. So we do have an amount, like a maximum of amount of money. But to be honest, like since like 2017, we never went close to that number, or we never exceeded that number. And I always say that if we need to exceed it, like we can get like special permission to extend the time and the money. Also, like we are reviewing like all the cases, but at one point, if like the client or the patient or the family say like, okay, like we're done, we want to move on like to an hospice or like to the hospital, like it's okay, you can. It's not because you use that program that's mean that to stay at home that you are not allowed to move to another facility. And for sure, like the program will stop as you're accessing like other facility that is pay different and you have like more care, but it's no limitation. Like that's really there to help you to stay as much as possible at home.
Okay.
With your family, and like to make sure like we are like there and we are able to provide care to make sure that the client, if they wish to die at home, like they can.
Okay, thank you.
You're welcome.
Great. There are some other further questions in the chat here. Kathy, did you want to read those out?
Donna McCowan is asking, so we can hire, do you have a pool of people who are available to help for the additional in-home client services? Carolyn.
The palliative care, home care, like have like a list of provider like for all rural in the Calgary zone, and that include like a list of people from the Bow Valley. So you can have that list when you're accessing like the funding, and also like what we're like usually telling the client is as well, we refer them to Tara at FCSS because they do have a list of like a provider, and it's usually how we are working.
Is that good, Donna, for you?
Yes, that answered the question. I don't know if Banff has anything like that. I have asked FCSS Banff, and they've assured me they're compiling a list, like the one that Canmore has. That's great. I know that the medical help that you can acquire that's on the list is in flux, right? People come and go off of the list. So it's nice to have that updated as often as you can. It's really, really helpful. Thank you for it.
So what I presented like is included BANF because I'm like the manager of BANF as well. So in that list that we have for the in-home funding, we do have some caregiver that are available to work in BANF. And I know that the counterpart of FCSS in BANF, it's Sue Smythe. And she is like usually updating that list, and we are like with home care, like working close to them. But with that in-home funding, what is like really nice is that if you have a family member that is a retired nurse or like someone who are like in your family want to take care of you and take a leave from their work, like they can get like paid to be your caregiver and take care of you. So that's really nice.
Thank you.
Carolyn, you had said that the palliative period of time is usually around 6 months. Can a family who it's a wife and husband, the husband is debilitated because of a palliative chronic disease, can they ask for respite while that person is well enough to stay at home and be walking around, but say the wife needs some respite for a couple of days or even for a couple of nights?
Yes, like it's again, it depends of like the situation and what is like the care that person need. They have like many of option like in home care, and we have different approach. So sometimes we have what we call like self-managed care clients. So if it's a client that we feel that have like maybe more time, they will be eligible to another kind of program that they can hire their caregiver privately.
Excellent, thanks. And Tara, how does FCSS fit into that, into respite kind of? Do you have a role in at respite?
We don't have a specific role other than keeping the resource list up to date to provide to folks of who they may be able to hire privately to support that, but we don't play a role in respite.
Okay, thank you. And Norm Dreger has a
sorry, our program, home care program, we have a healthcare worker that are like nursing aid, and they are doing personal care and respite for clients in the community. So depending of like what is the need, like it can be done through home care, and like the in-home funding for palliative care is just like something in addition, an additional funding when you need it.
Excellent. I'm going to move on to the question from Norm Dreger. Is this the $10,000 cap for third parties? I think, Carolyn, when you were talking about the program from 2017, Norm, is that true?
Well, I think she answered it. I'm thinking this was kind of the Bevberg program, and they had a cap on it, but you answered it quite well, that there's, there's some flexibility applied depending on,
of course,
whether or not the whole pool of money is gone, I suppose. If it's not, then you can be more flexible.
It's exactly the Bevberg program.
Okay, no, it's great.
Tara, I'm interested in, oh, sorry, Penny, go ahead.
Great, thank you. Thank you, Carolyn and Tara. It's really interesting to hear this information. I'm Penny Gall. I'm one of the board members of the Palliative Care Society, and we have been researching what's available, but it's really helpful to hear from you. I'm interested in the Calgary Zone Rural Palliative Care Funding Program, which you've talked about most recently. And one of the things that you talked about was it was for additional home care or services for a patient and family, a palliative care patient and family, to keep them at home. But then you also said when they could no longer stay at home, you said it could be used for other facilities. So I just want clarification. So when the hospice is built, would that funding then be available for patients to go into hospice?
No, I'm sorry, maybe that wasn't clear, but what I wanted to say is like, this is to have provider giving care to someone to stay in their home.
In their home.
And if at one point they're moving to a facility, it's okay. Like, it's because some people were thinking like, oh, if I'm taking like that fund, that means that if I want to go to a palliative home or if I want to go back to the hospital, I can because I use that fund. So no, it was when you're decided to move to another level of care, an hospice or an hospital, it's okay. Like, you know, we're just gonna stop like giving you the extra for like hiring someone to give you care as like you're gonna receive the care in those facilities.
Mm-hmm.
I'm sorry if it was not clear, but it was more than we had some client in the past that were afraid that if they use that fund, they would not be able to go in the hospital if they want to decide at the end to pass there.
Right. Or if they ended up going into the hospital and coming home because they got better, the funding would still be there for them.
Yes, it will resume.
Mm-hmm. Okay, thank you.
I don't see any other questions on the chat. I have one for Tara. Tara, how do you define your clients? If someone was struggling with the power of attorney and they weren't in a lower income, could someone like me come to you and say, I'm struggling with this one thing, can I talk to you about it?
Absolutely. The vast majority of our programs are open to anyone, regardless of where they live. It's just the odd program that has an income threshold on it. So if anybody was wanting to know about how to do a power of attorney, they could come in and we would support them with that, or arrange to do it however made sense for them. It's just the odd one, like income tax, because that's a CRA program. We're only able to do it for people under a certain income level. The same thing with the taxi passes. The intention is that people who would be isolated due to not being able to afford essentially a taxi to get them out and about and to be able to be in community at least a bit. So those are why a few of them have income thresholds. But that's very rare and also situational. So we have an income level, and if somebody's situation has changed and they used to earn that, but because someone is palliative and they are no longer able to work, we certainly weigh out people's situation as to what their notice of assessment says and what the reality of their life is, to make sure that we're not leaving people really in need who can't afford a service out based on their financial situation.
Excellent. And I'm gathering from how the two of you have spoken that you have a relationship together. Like you're not in silos. Would you say?
No, that's correct. I've never actually met Carolyn. Mavis is the person who does the bulk of our support for seniors and people with disabilities, although one other team member, Lou, also has the Cycling Without Age and Meals on Wheels and some of that. But no, our team is invested at a multitude of levels in all sorts of AHS collaboration and work together, so that we try to complement each other rather than do anything contradictory or duplicate, so that we don't maximize the use of our resources in the Valley.
We're really grateful for all the program from FCSS, and our client are too.
Thanks. That's nice to hear, because yeah, one of our main goals, and when we look at our demographics, we can see that the need to help people stay independent in their homes is a huge goal for us as well. We know that's where many people report wanting to be. And we can't foresee as the aging population happens, any way that people who need to go into a home are ever going to be able to, we're not going to have the home numbers here. They're going to have to leave community to do that. So if we can help people stay in their homes and be successful, that's really a key goal for us as well.
And Carolyn, you said the budget has never been used to its maximum for help in the home, correct?
Well, like it's because at the beginning of that program, they were like afraid to talk about the $10,000 because they were saying, oh, people will maybe be careful the way they're using the money. So basically we had a 10,000, but that is like a number that can, like I said, move, but like it never happened that we came close to that number. Usually what happened is that the client passed before we are at that number, or yeah, it's never happened for now. So, but always like we have the flexibility to go a little bit over if we need to.
I'm thinking of the baby boomers coming up, and do you think the budget is ever going to be ready for the numbers of people who are going in deeper into their 70s and the ones following up in their 50s and 60s? Do you get involved in any conversations about managing those numbers?
I'm not too sure, like what are you referring on? Like, is it like
those of us who were born after the World War II, so the baby boomer situation from
baby boomer? Yeah.
War
Well,
to, I think the youngest is around 56. They're considered of the baby boomers.
yeah.
And do you ever get into conversations where they're prepared to deal with? Because I think a lot of us would like to talk about being at home and not having to go to the hospital.
Well, I think AHS is investing a lot like with home care and making sure that we are focused on like keeping people safe as long as possible in their home. And it's really what we're seeing here in the Bow Valley. Like we're quite busy and we are getting like more staff as like the referral or like getting like bigger. So we've been like extremely, I will say, lucky, and I'm not seeing like any decrease in the services anywhere like soon. Probably the opposite.
Excellent. Good to hear.
Yeah.
Yes, that seniors population is growing more than twice as fast as any other component of the Canmore demographics. Banff, not quite the same demographic picture, but in Canmore, when you look at the community monitoring report and the aging population, not only do we have people who are living here or who are going to be in that boom aging in, but the people who are coming to retire here and growing, that percentage of our population is growing significantly faster than any other age group. So it's something that's certainly on our radar to continue to watch and sort of plan so that we aren't all of a sudden in a state of crisis versus sort of planning for what we can see coming.
I'm wondering if anyone else on the program has oh, sorry.
Yeah, I just have a quick question for Tara. Does FCSS Canmore, I guess it's Canmore Banff, is it? Are you two different structures?
Two different structures.
Okay, so does FCSS Banff cover Lake Louise, and does FCSS Canmore cover Exshaw, Deadman's Flats, Kananaskis, Morley? Does it cover all the way out, or how far out does it go?
So FCSS Banff covers ID9.
Okay.
And then because
sorry, what is ID9?
Oh, sorry, Lake Louise.
Okay.
And then sorry, I've got noise in my background here. Because it's an MD, they actually receive an agreement with the province that they sign and accept FCSS money. And with that MD zone, we get 2/3 of it given to Canmore to support Harvey Heights, Exshaw, Lactazark, Dead Man's Flats. The other 1/3 of their FCSS allotment goes to the town of Cochrane to support benchlands, ranchlands, that zone. Unfortunately, with the current structure of how FCSS is done in the province of Alberta, it includes MDs, counties, municipalities, and Métis settlements, but it does not include reserve. That kind of support is sponsored and funded through the federal government. And so FCSS does not encompass the Stoney Nation Reserve.
Oh, thank you for that. I did not know that. So thank you for that clarification.
They are getting though similar like money for a similar program on the Morley community, and it's like basically managed by the Stoney Health Center.
Okay.
Richard, did you leave? You had your hand up and I had missed it. I can't find him. I think he left.
I'm just going to say one thing before that next question. That being said, we don't go out to Morley or to Stoney to offer anything. Anybody who walks in our door, if they're from Texas, Canmore, or Morley, they get the service and support that they need. We don't ask you for your residency in order to support you if you're coming into our office. If you're registering for a workshop, anyone who wants to register is welcome to do so. We just don't go out actively providing services on reserve.
Rosemary.
Yes, I have a question for Carolyn. Did I see on your slide pack that the cost of the palliative drugs were included in that program?
No. What is included is like when you have a palliative like diagnosis, you're eligible for palliative Blue Cross, and we can help like with your family physician to fill out those forms and make sure that you are covered for some medication.
Oh, okay. Thank you.
Anyone else in the audience have a question for Tara or Carolyn?
Penny here again. Carolyn, my guess is just listening to what you have to say and hearing about the flexibility of this program, the funding program, is that really you would work pretty hard to find the assistance for anybody, a palliative care patient and family in the Bow Valley who needs help in staying at home. So even though all of the costs may not be covered, it sounds like your team works pretty hard to try and cover as many bases as possible.
Yes, I'm really proud to be a part of like our like home care team, Canmore and Banff. Like we have very high skill like professional who had like an interest in palliative care and are always like seeking for more education, and they're so dedicated to the family. And again, like I say at the beginning of my presentation, our goal is to be very patient and family focused. So when we get in someone home, we are trying to be chameleon and trying to make sure that we understand the value and make sure that we are adapting ourselves to the client and their family. And it's really important. And I think we all share that same value in that team. And yeah, it's a pleasure to work with my coworker for sure.
Well, as a Bow Valley resident, I'm sure I can speak for others. We're very lucky to have you. So thank you for everything you do. And Tara and your team.
Thank you. Thank you all.
I know Tara and Carolyn, we are so pleased. You two are so busy, and really appreciate you giving us your time and your valuable information. I want you also to know, as Penny says, your reputation in the Valley is so good. You both manage excellent teams, and we as the residents are very proud of what your teams do for us also. Thank you so much. And just to remind everybody again that we do have a resource book that's been put together, but not with all the information that Carolyn and Tara have just given us. And again, if you want a hard copy, Michelle's gone too. Michelle is in the office and her office number is 403-707-7111, or look on the website for that. Carolyn.
Yes, I just want to kind of also like mention that I'm the manager as well for the Bow Valley Cancer Clinic, and we have like an amazing team of nurses, and they are like working like really closely with the client and home care and the palliative care team, and they are available for resources as well. We have a nurse navigator, her name is like Fiona, and she's like really available for all like cancer client to give them like resources or help and support. So we are all at the same number.
Okay, excellent. Is that Fiona Garforth? Les?
Yes, she just texted me saying she mentioned me.
I knew that's what happened. I was watching that. I thought, I bet you that's what happened.
Fiona, if you'd like to take your video off, we can see what you look like and see how you are of value. Where did she go? Oh, there.
I'm here. I'm not sure if you can see a video of me. Can you hear me?
Yes, we can hear you, Fiona.
Okay, yeah, sorry. I just, I did want to give a little plug because I know that some people don't realize that there is a cancer clinic here in the Bow Valley, and we look after anyone with a cancer diagnosis, you know, anyone from Cochrane West to Lake Louise, Invermere. So, and some people think we're only here just to give treatment, but as Carolyn said, we work closely with home care and the palliative care team to just support anyone with a cancer diagnosis. So we're very much part of the same team as they are.
Thank you very much. It's very nice to meet you.
Yeah, nice to meet you too.
I think that brings, we are 2 minutes from 1 o'clock and people have things to do, places to go, especially Carolyn and Tara. So thank you again, ladies.
Thank you, everyone.
Thank you.